Hi there, this is Dr. Linda Khoshaba, and I've made this video just for you, and we're going to be talking about hair. So I want you to think about what are the top things that you think are contributing to hair loss. So the main concern is hair thinning, hair falling out, breaking. It just looks really thin, especially from the top. So the main things that can contribute to hair loss or hair thinning include nutrient deficiencies, hormonal imbalances, stress, and yes, there is a genetic component to it. So I'm going to talk a little bit about these four things in a little bit more detail, and I'm going to help you identify where you could be struggling with and what you can do about it, okay? So when we talk about the first thing, which is a nutrient deficiency, I want you to kind of think about a main condition that is associated with hair loss, and that's iron deficiency anemia. And iron deficiency can result as an inadequate amount of iron you're consuming in your diet, and sometimes you might just be more prone to it. Females are especially prone to it. So getting a basic blood work done, there is a lab marker called a CBC. It stands for a complete blood count, and that is just a quick and simple way of identifying if you have any kind of anemia going on. So ruling that out is important. Number two is hormonal imbalances, and out of all of the hormonal imbalances, the major one that's related to hair loss is thyroid disease, especially hypothyroidism. So getting, again, your thyroid kind of worked up in terms of blood work, maybe you need an ultrasound just to identify if you have an underlying thyroid condition going on, and treating that would be super critical. And then we talked about stress. So what are you doing every day in your life that is helping you to manage and cope with stress? Because stress does affect us, especially in negative ways. And for women and men, if we lose our hair, we're losing a huge component of our body and our self-image. And without our hair, this is an accessory that we have, and we all love to style it, and we spend so much money on coloring and cutting and styling. So if you tend to lose that, you know, what goes with that is you start to lose your self-esteem. So we don't want that to happen. We want to help you maximize your hair, get the hair that you need, and keep it there long and keep it there strong. So stress management is super critical, and simple things that you can do on your day-to-day life to help you manage: breathing exercises, yoga, meditation, and being consistent. Consistency is so key when it comes to managing stress. So if you're not already incorporating some kind of stress reduction techniques in your life, I would highly recommend you start there. And then another component which we might be born with, in the genetic component, yes, females also get this condition. It's called female pattern baldness, and no matter how much they treat their hormones or their nutrition, if it comes down to a genetic predisposition, they might lose their hair. So, but in those women, and men, actually found out a cool strategy and a therapy that exists to help them manage it. And I'm gonna pull it out, so stay right there. Okay, it's a super cool baseball cap, right? So that's what it looks like. And inside the baseball cap, there is 272 laser diodes. I'm going to show you how it works. Here's the battery pack that it comes with. That's the on button. And you can see that when I'm turning it on, you see this red light flashing. That laser is a low-level laser that's intended to stimulate the scalp at the follicle level. Let me turn this on. Awesome. You don't feel anything. There's no pain. And it's intended, like, the treatment duration is half an hour. You wear this 3 times a week. And it's super easy, super convenient. You can walk around with it. I actually went to California for the long weekend, and I had it in my car, so I was driving with it, and no one can tell, like, what's going on. There's no, like I said, no pain or anything going on or irritation associated with it. And this has actually been an FDA cleared device that's been shown to help bring back your hair and keep it there stronger, especially in those patients suffering from alopecia, which is an immune attack, autoimmune attack to the scalp, resulting in baldness. So this is like a simple, cool way to help treat when it comes to those tough conditions that cause hair loss. So last but not least, I also wanted to discuss a cool way to analyze to see how thin or thick or at risk you are for your hair. And it's a cool device. It's called a trichoscope, and it's a medical device that basically it's like a little magnifying glass that you can take and look at the level of the scalp. There's a 50 times zoom on it, and then you could see from that level how thick and how thin the hairs are coming out of the scalp. It's a direct look at that. So it could be freaky a little bit, but it actually shows you at that in-depth zoomed in level what's going on. So from that analysis, we can see how bad is the condition, how, what you can do. And then if you do something like a laser cap treatment, if you do get your thyroid then checked out and addressed and all that, then you come back and do another scalp or hair analysis, and then you can see with the duration of your treatment, is your treatment actually working? So with technology and with nutrition and with medicine all combined, taking this integrated approach to it all, you can keep your hair, keep it there strong, healthy, and honestly you'll feel so much better. Your self-esteem will come back, you'll feel happy, because there's nothing worse, especially for females, to have your hair go. For men, yes, it might suck, but you don't have a social problem, because you can just shave it off and people will be okay with it. But for females, seriously, like if you lose your hair, you just kind of have that low self-esteem associated with it. So I really want to help out those women and kind of reach out and say, hey, I know what you're going through. I've had similar case happen to me in the past, but with all the medicine, all the knowledge, and all the things that I brought to the table, I got my hair back, and I'm super happy, and I'm very excited to kind of help you get there too. So if you have any questions, feel free to contact me, and I can help you get your hair and health back on track. So thanks for listening. Do also keep me posted if there's other specific videos you want, especially on hair, or I can go into more depth. This is just kind of a general overview, but thanks for listening. Take care. This is Dr. Linda Khoshaba from Integrative Health. Thank you. Bye-bye.